You know, as we get older, more people seem to want to take advantage of us, especially, you seniors. Well, what do? I mean, there's scams out there that are running around, people calling you saying, you need this, you need that. Well, do you really? Well, we have brought in Danielle Guillory, who is the Community Outreach Specialist with the Senior Medicare Patrol. And that sounds, really serious. The Senior Medicare Patrol.
It is.
Like
it
you have
is.
little badges you run around.
We do. Senior Medicare Patrol is a government grant program. We're federally funded through the Americans for Community Living. And what we do is we're in all 50 states, and we're funded to go out and teach seniors about the current Medicare frauds and scams. And we do that through community education, outreach, one-on-one education services, and
television shows.
We also are at the churches, the senior centers, like WLOX's upcoming health fair, and we're also going to places like the retirement apartments, and we try to give the seniors education on how to protect themselves for the calls that they get and then some situations that they wind up in.
Now, if one of these places like churches, senior homes, whatever, they want to have you come out, is there a charge or anything for that?
There is not. As a government grant program, we are free to the community. That
they
is
just
our
call
whole.
you?
That's it. They call me. They can call. I believe you'll have our
the
number
800
up.
number is on
right.
on the air.
They can
screen
call.
there.
They can call that number and ask for us to come out. They can also call me directly, but if they call the 1-800 number, they can get someone there. There's actually a human being who answers the phone at that number.
Good.
Yes, and they will get them in touch with whatever part of the state that they are needing. We have 3 full-time people here in Mississippi. I cover the Gulf Coast area, but we also have someone in Jackson, and we also have someone in the north part of Mississippi. So we cover the whole state, but there are only 3 of us, so we rely heavily on volunteers.
Danielle, I'm 2 years away from being eligible for Medicare. How serious a problem is Medicare fraud?
It is a $60 to $100 billion per year problem.
Wow.
Fraud is costing Medicare. I'll give you a prime example. Every minute I sit here and talk to you is $114,000 that Medicare is losing to fraud. And we as non-Medicare recipients can't stop that, but I can educate people who are on Medicare so that they read their Medicare summary notices and make sure that what's in that information is their doctor visits. You want to make sure that it's the date you went, it's your doctor, it's somewhere you recognize. And if not, if we don't get this stopped, Medicare cannot survive at $60 to $100 billion per year.
Wow. What are some of the current frauds going on right now?
The biggest one that we're having here on the coast and that we're actually seeing happen is genetic testing fraud. And what that is there are genetic testing laboratories that are coming out and offering to do genetic screening for cancer for our Medicare beneficiaries. They're going to the senior centers, the churches, anywhere that seniors gather, and they're offering this test, but what we're finding is that the recipients are never ever receiving any results. And they're asked to give their Medicare number, they're asked to give all their personal information for a test that they really don't need. And we consider this to be abuse of the system. Medicare may pay for it, but it's an unnecessary test. And so we're trying to get the word out for people.
So they're paying for it, but the Medicare is paying for it, but these people are pocketing the money.
They are, and the recipient.
And the senior has paid how much for a test?
The senior pays nothing, and
Okay.
that's how they get them is they tell them it's nothing out of their pocket. But ultimately it is out of their pocket, because if we lose those Medicare dollars on something unnecessary, then that money cannot be spent on the things that need to be done to help our seniors stay healthy.
Now, if they have some suspicion of someone, at the call either calls them or or is at some kind of function, Can they call the number on the screen there
They
and
absolutely
ask
can.
questions regarding it?
Yes.
Are these people reliable? Are they legit?
Yes, exactly. That's what we are there for. We're there for them to report if they detect or believe that they've been the victim of fraud, or if they just have a question about how to read their Medicare summary notice. They are absolutely able to call us at the 1-800 number. Costs them nothing. We have a human being on the other end of the phone who will walk them through that process and help them. If it is a case of fraud, we will get it reported. If their Medicare card has been used in a fraud, we can get them a new Medicare card. Well, we won't get it, but we'll help them get a new Medicare card. Any questions that they have, that's what we're there for. That's what our grant helps us to provide.
Now, you said they're doing offering quote unquote genetic testing for cancer.
Correct.
Which is something that you said they'll do, like a swab in your mouth.
They do.
But
they do a cheek swab.
You know, just because your parents had it doesn't necessarily mean you say it's kind of after the fact is when you supposed to do a test or something.
You actually should do the test when your doctor feels like it is medically necessary. And it should not be offered just at a health fair, at a senior center, anywhere. You should be having this test done by your oncologist or your personal physician. If he doesn't deem it's medically necessary, then it's not something you need.
All right, and what can seniors do to protect themselves?
They need to be aware that they need to protect that red, white, and blue card, their Medicare card. They need to not give that number to people on a telephone, on the internet, or through the mail, only to their health care providers. If they have a question about their Medicare summary notice and something doesn't look right, call us and let us help them. If they just have questions, call us and let us help them. We have both the website, which you have on the screen.
StopMedicareFraud.org.
Yes.
And then the number, as you mentioned, is on your screen too. 877-272-8720.
Correct.
Is the number that you can call as well if you have any questions or you feel like someone has committed fraud on it. And if somebody, if you're at one of these health fairs or something and somebody's at a booth says, let me swab your mouth and see if there's a chance, don't do it. You need to call.
That's it. Only give your medical information to your healthcare providers. That's the best information we can give out.
All right, Danielle, always a pleasure to talk to you.
Thank you.
Great information for those of you that you may already have Medicare, or you, as me, you're fast approaching that age. So you want to make sure you take all the necessary precautions that you can, and give them a call if you have any questions at the Senior Medicare Patrol. Phone number is on your screen, or you can check out their website. Thank you so much.
Have a great day.
You too.
Are we done?